Question: A 50-year-old male presents with persistent dysphagia, weight loss, and a long history of tobacco and alcohol use. Upper endoscopy reveals an irregular, ulcerated mass in the distal esophagus. Biopsy of the mass demonstrates well-differentiated squamous cell carcinoma. What is the most likely risk factor associated with the development of this condition in this patient? A. Helicobacter pylori infection. B. Barrett's esophagus. C. Human papillomavirus, HPV, infection. D. Chronic gastroesophageal reflux disease, GERD. The most likely risk factor associated with the development of well-differentiated squamous cell carcinoma in the distal esophagus in this 50-year-old male patient with persistent dysphagia, weight loss, and a long history of tobacco and alcohol use is. The most likely risk factor associated with the development of well-differentiated squamous cell carcinoma in the distal esophagus, D. Chronic gastroesophageal reflux disease, GERD. The patient's clinical presentation, along with the findings of a well-differentiated squamous cell carcinoma in the distal esophagus, suggests that chronic gastroesophageal reflux disease, GERD, is the most likely risk factor contributing to the development of this condition. Here's the rationale for choosing this diagnosis. Persistent dysphagia and weight loss. The presence of persistent dysphagia and weight loss are common symptoms associated with esophageal cancer, often seen in patients with chronic GERD. Tobacco and alcohol use. Both tobacco and alcohol consumption are well-established risk factors for the development of squamous cell carcinoma of the esophagus, particularly in patients with a long history of use. Options A, B, and C are less likely in this case. Helicobacter pylori infection, option A, is more commonly associated with the development of gastric and duodenal ulcers and gastric cancer, rather than squamous cell carcinoma of the esophagus. Barrett's esophagus, option B, is a known risk factor for the development of esophageal adenocarcinoma, rather than squamous cell carcinoma, which is more strongly associated with chronic GERD. Human papillomavirus, HPV, infection, option C, is linked to the development of oropharyngeal cancers but is not a common risk factor for squamous cell carcinoma of the esophagus, particularly in the context of this patient's presentation. In summary, considering the patient's clinical history, presentation, and biopsy findings, chronic gastroesophageal reflux disease, GERD, is the most likely risk factor associated with the development of well-differentiated squamous cell carcinoma in the distal esophagus. Early intervention and treatment are crucial in managing this condition. In summary,